Hemophilia is a rare disorder in which your blood doesn't clot normally because it lacks sufficient blood clotting proteins, that is, clotting factors. With the COVID-19 pandemic having a major impact on people with a bleeding disorder, spreading awareness about the disorder has never been more important than this. On this World Hemophilia Day, we are speaking to eminent doctors and hematologists to create awareness about hemophilia disorders and their necessary precautionary measures. Hello, I'm Sana Khan, and today in this initiative, we're going to speak to Dr. Aniket Mohite. Dr. Aniket is a consultant hematologist, oncologist, and transplant physician at Arogyam Multispeciality Clinic, which facilitates complete evaluation and treatment of blood diseases. He's pursuing his fellowship in the LBMT department in Vancouver, BC, Canada, for bone marrow transplant. Please welcome Dr. Aniket to our show. Hi, Dr. Aniket, how are you?
Hi, Sana, how are you? I'm fine, how are you?
We're fine too, thank you, sir. Okay, Dr. Aniket, how severe can hemophilia be?
Hemophilia is basically hemophilia A or hemophilia B. There are basically 13 factors in a body which help in clotting system. So the commonest ones are factor 8 and factor 9. Deficiency of which is called as hemophilia A and hemophilia B respectively. Hemophilia A is more commoner, around 1 in 5,000 individuals, whereas hemophilia B is comparatively less common, and 1 in 20,000 to 25,000 individuals.
Okay.
So based on the amount of factor which is present in any person's body. So normally what we say is more than 40% or 40 to 100% amount of factor level is what is required for clotting. So whenever factor 8 or factor 9 percentage is less than 40, we call them as hemophilics, depending upon whether it's factor 8 or factor 9. And the severity is classified as mild, moderate, and severe. When the amount of factor percentage is 6 to 40%, we call them as mild hemophilics. When the factor level is 1 to 5%, we call them as moderate hemophilia. And when the factor level is less than 1%, we call them as severe hemophilics. Among all the hemophilic percentage, the severe hemophilia would comprise around 2/3 of the hemophilics. The major reason for that would be the mild and moderate do not come to notice because they bleed only when they undergo some procedure like a major surgery, or they would have some trauma. So they would not come to like emergency medical attention, like they would be having bleeding without any trauma. So spontaneous bleeding is common and severe. So that is why they come commonly to the medical practice or to come to us that we are having a bleeding and we are having so and so problem. But whereas the mild and moderate might not or would come to notice only when they are undergoing some procedure, post procedure, the bleeding is not getting controlled.
Okay. So, doctor, should families always have a clotting factor with them?
With the current scenarios, like clotting factor is available in n number of centers now all over India. To be precise, the government has supply of around lakhs of units of factor 8 and similar of factor 9, as well as patients with these can develop inhibitor, severe hemophilics. They can develop antibodies against the factor, considering that as a foreign antigen, and factor in those cases would not be effective and would require fiber, which is factor 8 inhibitor bypassing agent. So on a routine basis, to stop bleeding, patients who are on prophylaxis or to prevent bleeding, they should have some amount of factor at home for just emergency situations. But on a routine basis, they can just store few vials. But being it a costly product and it has to be administered IV as an IV push, proper technique has to be used because they have bleeding disorder. Giving it improperly would not be helpful. Secondly, the injection procedure can lead to more trauma. So a properly trained person, like a hemophilic nurse or comprehensive uh, hemophilic center, which we call as HTC,
Right.
is what there would be required, and it is available free of cost in all the government centers all over India. So that is why you can get it free of cost rather than bearing the cost of keeping it at home and buy it yourself and keeping it at home. And each vial of factor would be around 250 units, which would cost roughly around 3,000 per vial. So it is quite a bit of money which would be involved. And depending upon what kind of bleeding it is, whether it is just mild procedure or whether it is life-threatening bleeding like intracranial bleed, which would require 100% factor correction. So the dosages of the amount of factor which would be required at any given point of time would vary depending upon the site where it is bleeding. If it is joint bleeding, a 30% target would be effective. Whereas if it is bleeding in the GI tract, that they are having bleeding per rectum or having blood in vomitus or blood in cuff, that time we would go for life-threatening target of 80 to 100% of factor and achieve better clotting. So in such scenarios, the amount of factor which you have to keep at home would vary depending upon what site of bleeding it is. So you can keep always few vials just to control the bleeding, but it is always advisable to go and meet your physician, a hematologist, and then decide what amount of factor you would require and then go ahead.
Okay. So, Dr. Aniket, what should I do if I have hemophilia and have a bleed?
Majority of the hemophiliacs, hemophilia A or hemophilia B, would be bleeding in the joint. So joint bleeding comprises of 40 to 60% of the bleed, in which knee or the elbows or the ankles, which are the pressure joints. So elbows, when we are using it for writing. So when they are in their educational age groups and they're using it for writing their papers or writing their college works, that is when the elbow comes under stress. While walking, the body bears weight on the knees and the ankles. So that is why these are the joints which come under stress and would bleed in those points. If they are taking painkillers, which we advise them not to, because the routine painkillers which are given can cause GI gastric ulcers in any of us. So gastric ulcers in these patients can cause GI bleeding, which can be sometimes profuse and difficult to treat. So if I'm having a joint bleeding, which is a commoner site of bleed, which is around 40 to 60%, 10 to 20% can have GI bleed. Muscle bleeds are around 10 to 20%, and life-threatening bleeding, like what I said, vomitus, blood and vomitus, bleeding in the brain would comprise around 5 to 10%. So the commoner, coming to your question that how I treat, what I would answer would be for a joint bleed, which is much more common in a hemophilic scenario. So according to the World Federation of Hemophilia guidelines, the first thing which you should start doing when you are right at your home is PRICE, which we call it. This is an abbreviation for the initial line of therapy which you can do at home itself, which is protection of the joint. Suppose your right knee has bled and you are having so the symptoms of any bleeding in a joint would be excruciating pain. So it is like you are putting a needle in your bone without any anesthesia. So it is like an excruciating amount of pain which that patient will be having because of the bleeding in that joint. There will be warmth and there will be tenderness that would restrict the patient to move that joint or bear any weight on that joint. So the first thing is to protect the joint from any further damage.
Right.
That is to give it rest. Second is RICE. So PRICE is protection, rest and immobilization. I is for ice application, C is for compression, and E is for limb elevation. So I'll just give this in a bit of more detail. That to protect the joint, you can like rest it on your bed itself to avoid further damage. Rest and immobilization is you can apply compression dressings like the crepe bandages which we have, or like the knee stockings which we use in our day-to-day life. The similar thing can be used, which will help the joint to act as a single unit rather than having segregated. So the limb would act as a single unit and would avoid or transfer the pressure on the knee to that immobilizing device or to the compressing bandage, and would transfer it to the lower part of your joint or lower part of your leg, so that you can walk with some amount of support. Ice application is supposed to be not done directly because of the nerve problems which can also occur in bleeding. So that is why you have to wrap your ice packs, which we advise them to keep it at home in a refrigerator, in the freezer, and wrap it in a cloth. Apply some cloth on the joint, and then apply ice for 10 to 15 minutes and give it rest off period for around 30 minutes, and keep doing this for 4 to 6 times till you are able to reach the place where you can get the factor. And E for limb elevation, you can just put some pillows in beneath your ankle or beneath your calf, just to elevate and to help circulation in your leg in a better way, so that you're not having clots in your leg. Your venous circulation is better, your arterial circulation is better, so that it will help in improvement of your bleed, as well as would not compromise the blood flow to the lower part of your leg. So along with this, factor infusion is what is necessary. So in a joint bleed, factor 8 would be given around 30 units per kg. Each unit of factor 8 would increase it by 2 units. So if you are planning to give 30 to 40%, consider 40% for a right knee, and in a 50 kg individual, you would be providing them 2040. So 20 into 50 would be 1000 units of factor 8, whereas for a hemophilia B, it would be 2000 units of factor 9. So this can be infused every 8 to 12 hours for next 1 or 2 days, depending upon it. That would help to reduce the bleed, but for a longer duration, to not have recurrent bleedings in the same joint, we advise them physiotherapy, which is slow exercises, because they cannot do any rigorous exercise and worsen the bleeding. So physiotherapy follow-up along with a proper bleeding stopping agents like tranexamic acid or ESEA is what would be given. And pain medications can be given like Ultracet or Iterocoxib. So that is how we would be treating a joint bleed. Whereas if the bleeding is systemic, we advise them to get admitted, give them regular factor, because the hemoglobin would drop also if they are having bleeding in the like hemorrhoidal bleeding or bleeding in vomitus, which can be life-threatening. So we don't send them home. We keep them inpatient, and we would provide them factor for the next 4 to 5 days till the bleeding stops and till the symptoms that the patient is out of danger because of all this bleeding.
Hemophilia A occurs in 1 out of 10,000 male births, while hemophilia B occurs in 1 out of 30,000 male births. India may have over 70,000 patients with hemophilia A and B. As a dedicated healthcare media platform, through this initiative, we hope we are able to educate and aware people about hemophilia. Thank you so much, Dr. Aniket, for taking out your time and giving us such significant information about hemophilia to our viewers today. It was a pleasure having you on the show.
Thanks a lot. Same to you.
Thank you so much. Take care, sir.